So welcome back. Today we will be talking about giant cell arteritis. It is a type of vasculitis of large blood vessels that was first described in 1890. It also goes by another name called temporal arteritis. And this is when the immune system becomes overactive, we don't know why, and it attacks the largest blood vessels in the body, giving disease. And as we already learned, there are some general symptoms such as losing weight for no reason, tiredness, low-grade fevers, usually over a few months. But in this disease, it can also happen a little bit more suddenly. And in these patients, it will affect the aorta and its branches. Now, the aorta is one of the largest blood vessels that comes out of the heart and then kind of curls over and goes to the rest of the body. So the largest blood vessels are sent to the head and then to the arms and to the legs. So these patients will get superficial headaches. They'll get tenderness of the temporal artery, which is right here. They can get blurry vision or sudden blindness for a second that comes and goes. They can get jaw claudication or tiredness with chewing their food, and they can get stiffness and pain of the shoulders and the hips. This disease, even though it's considered one of the most common primary vasculitises of adults, is actually still pretty rare. You would need about 10,000 people in a room above the age of 50, because this is a disease that attacks patients above the age of 50. You would need 10,000 of them in a room for even one person to have it. It is more common in women, and it is more common in those who are white of Northern European descent. As far as the diagnosis of this disease goes, it's just like everything else in medicine, where the outside has to match up with things that are found on the inside to get the right diagnosis. So in these patients, the headaches, the temporal artery tenderness, the vision issues, the jaw claudication, the stiffness of the shoulders and the hips, and then very high inflammation in the blood. And also making sure other common things are ruled out, but also other rheumatological diseases such as rheumatoid arthritis, etc. Sometimes a temporal artery biopsy is needed, meaning a piece of this blood vessel, and you look at it underneath the microscope to see if you see disease. However, in these patients, the disease has what is called skip lesions, which means it will attack a part of the blood vessel, but then won't attack, and attack a part of the blood vessel and won't attack. So you need a larger piece to look at underneath the microscope. And sometimes there are certain scans like ultrasounds or angiograms that can also help. When it comes to the treatment of this disease, treatment, just like any other autoimmune disease, is you push that immune system down to make the disease go away. So in the beginning, it's usually high-dose steroids. And it's important to note that the treatment should not be delayed while one is waiting for a temporal artery biopsy, because those biopsies can still be there or still show disease even after treatment is started. However, that vision issue, once that vision is lost, it is permanent and it doesn't come back. Now, the second step, as we learned, is you choose a steroid-sparing agent. So you choose a medication that will do the job of the steroids without the steroid side effects. And some of these are pills, some of these are injections, some of these are IV. In these patients also, especially in the first few months, a baby aspirin is started just to help improve blood flow to the head and to avoid any strokes. And then also managing other diseases that either the patient may have come in with or some of the treatments or the medications are causing, such as osteoporosis and diabetes and hypertension and hyperlipidemia. And as in everything else, stopping that smoking is very, very important. As far as the long-term outlook in these patients, they do very well if they are diagnosed correctly and treated long enough, because if the patient's treatment is started correctly, but then stopped too soon, like less than 6 months if it's stopped, then the disease comes right back. The other thing in these patients is that for every 100 people that have this disease, about 15 will have some vision loss, and it usually is a permanent vision loss. The other rare thing that can happen in these patients is the aorta, as it's coming out of the heart and kind of going down the body, it can have what's called an aortic dissection, which means that the lining of the pipe or the blood vessel, the aorta, can separate from the wall itself and make the aorta a little bit weak. In these patients, they can get more heart attacks and more strokes, but not because of the disease itself, but because of the blood vessel is now inflamed and swollen, and blood vessels are a little bit narrow in general. And then finally, again, a very rare thing, sometimes thoracic aneurysms can happen, which means as the aorta is going down the thoracic cavity, again, because of these skip lesions, so some parts of the aorta are strong and some parts aren't, then the parts that are weak can actually pooch out or can balloon out, and that's called an aneurysm. Now, I know this is a very scary diagnosis for some patients, and especially the medications, they are started so quickly and they can be very, very overwhelming. But it is all done to prevent permanent damage. So, as the ancient physician Hippocrates would say, extreme remedies are very appropriate for extreme diseases. Until next time.